Hi everyone, Nicolette here. We are going to be covering some case studies today. I'm actually going to do one at a time. I am trying to improve in my diagnoses and assessments and prescribing medications. So this is why I'm doing this, and I think this will help a lot of you out there who are aspiring to be nurse practitioners or even doctors. So we're going over some real case studies. We're not going to mention any names to keep privacy for HIPAA laws. So here goes. So this person now is a 47-year-old male with a history of hypertension, polysubstance abuse, and they're on methadone. Their last dose was this morning. They missed their dialysis. They missed it the last two dialysis sessions, and that's why they came to the emergency room. They came there with shortness of breath and requesting for the hemodialysis. They don't have any fever, no coughing, no hemoptysis, no chest pain, no vomiting, no headaches, no change in vision, no abdominal pain, no orthopnea, and they do have a decrease in exercise tolerance, and they have said that they feel like their lower extremities are a little weak bilaterally, and it's worsening. Okay, so for history, they have bipolar disorder, depression. I'm just going to name a few of them: kidney disease, seizures, etc. Okay, they have hypertension, post-traumatic stress disorders, traumatic brain injury, to name a few. Well, actually, I think that was all of them. Past surgical history, brain surgery. They have, they are currently a smoker. They don't take alcohol, don't ingest alcohol. They have taken heroin and crack. All right. Okay, so now their review of systems, we're just going to go over what's positive, meaning if I don't mention it, the other things are negative, right? So respiratory, positive for shortness of breath, negative for coughing, chest tightness, and wheezing, which means when I said I'm not going to mention the others, I'm not going to mention the other systems, right? But anything in that particular system where there's positive, I'm going to mention what is negative and what is positive for it. So cardiovascular, they're positive for leg swelling, negative for chest pain and palpitations. That was a review of systems. So this is what they are telling us, right? For now, what I assessed myself, or what whoever it was assessed, was so for physical examination, their eyes is the eyes have pinpoint pupils bilaterally. They're musculoskeletal. It's normal range of motion, but the right lower leg has edema, and it's no tenderness, and the left lower leg has edema with no tenderness. And remember the dialysis. They're on dialysis, so the dialysis access noted to be on the right upper chest wall. So no erythema, no drainage. They were on some medications in the past. They had ascorbic acid, 200 milligrams, one tablet. They had aspirin, 81 milligrams by mouth. They had Rocotrol, one capsule, 0.5 mcgs daily. They had calcium acetate, 667 milligrams 3 times a day. They had calcium carbonate, 2 tablets, 3 times a day. That's 648 milligrams. Clonidine, 0.3 milligrams, 1 tablet, 3 times a day. They had Depakote, 125 milligrams. They were taking 4 capsules, every 12 hours. Hydralazine, 100 milligrams, 1 tablet, every 8 hours. They were on labetalol, 100 milligrams, 12 hours, every 12 hours. Lisinopril, 10 milligrams, 1 tablet by mouth every day. They were doing the methadone, 60 milligrams daily. They were doing Norcan, that's if they had overdosed, it was 0.1 milligrams. Well, it was 4 milligrams per 1 ml liquid nasal spray. They were on nicotine, 21 milligrams per 24 hours, 1 patch on the skin. They were on nifedipine, 1 tablet. It's 90 milligrams. They were on Protonix, 40 milligrams every morning before breakfast, 1 tablet. They were on Veltassa, which is a 0.8 gram total packet, 2 packets by mouth daily. They had Senna, 17.2 milligrams, is 1 tablet at night. Zocor, 20 milligram tablet, 1 tablet by mouth nightly. And zinc, 220 milligram capsule, 1 capsule by mouth daily. So this person had been allergic to fish, they were allergic to Haldol, they were allergic to buprenorphine naloxone. Okay, vitals were fine. So now with the assessment, we already know, like I said, they had shortness of breath because they had missed dialysis. So they were afebrile, meaning no temperature. The vitals were normal. They had a reduced ejection fraction. There was no D sign. Their EKG showed NSR with VR 80 beats per minute. No peak T waves or sine waves. T wave inversion in the second, third AVF and V6, unchanged from prior. Hepatitis lab done at the last emergency department visit. And so now the plan is to do an x-ray. This is where you really have to pay attention, right? So the plan for a person who comes in with problems of shortness of breath, who didn't get their dialysis done, right, is to do a chest x-ray, right, because they have shortness of breath. You want to see if there's fluid in the lungs, to do labs to see what kind of toxins and whatever is inside is in their blood, renal consult for probable hemodialysis, because that's why they came to the facility in the first place, and reassess for disposition. So that was our first case study. So again, thank you for watching. I will see you next time for our next case study. Bye.